Oh, we're rolling. Cool. Hello, everyone. My name is Dr. Nick, physical therapist, and we're going to continue our series this week on the second most common run-related injury, which is iliotibial band syndrome, or IT band syndrome. As always, before we get started, don't forget to like, subscribe, and share this video to someone who may need it. A quick anatomy lesson here about the IT band. It is a long, thick piece of connective tissue that runs along the outside of your leg and attaches just below your kneecap. Notice I said connective tissue, not muscle. Like I mentioned before, it's the second most common run-in related injury. It's more common in women than men. Sorry, ladies. The big thing is that this was once thought that it was a friction type injury, which means that area just got irritated, and one of the most common things people think of when they think of their IT band is let's roll it out. Let's grab a foam roller, let's smash that outside, bada boom, bada boom, it's all better. Well, that's not really the case. First off, with a foam roller, you're not really fixing anything, you're not really lengthening anything. So it's not really the best thing to do for that type of injury, number one. Number two, and the big reason why it's not the best thing to do for that type of injury, is it's not really a friction type injury. What we learn now is that the IT band syndrome is more of a compression injury. Now you may be thinking, what gets compressed? Well, there's a little fat pad on the outside of the knee, and that IT band runs right over the top of it. So the repeated bending and straightening of your leg with running is causing that area to compress and tighten and rub against the outside of the knee. So that's what's causing it. Now, what do you look for when you have this type of injury? Well, you want to look for a really bad, sharp stabbing pain along the outside of the knee. You're going to see if this person has started running. So this might be a new runner. They may have started running a lot more frequently. So we always look for that increase in running volume. We also want to look for pain while we're going down hills. Not necessarily hills while running, but also going downstairs is a big one. You're also going to look for pain at a certain time in your run. Now, when's that going to be? It may be a little bit different for everybody. More often than not, it's going to be towards the end of the run. Why is that? Well, since we mentioned before, it's a repetitive compression type injury. So with longer durations, it's just going to compress that fat pad more and more and more. So we think that with repeated compression, those repeated strides over time, you're going to have more pain at the end of the run compared to the beginning of the run. Now, what else are we going to look for? We're going to look for pain again with that into that side of that knee. With excessive bending, you're going to look at weakness into the hip abductors and the external rotators of the hip. Hip abduction weakness is not the answer to everything, but it seems that way. We're also going to look at abnormal gait mechanics when running. So basically, how does your running look? So with someone with IT band syndrome, what is your running mechanics going to look like? You're going to see what we call an increased femoral adduction angle. So what the fuck does that mean? Basically, what that means is that femur is going to adduct, so it's going to cave in a little bit more in these individuals, which means there's more stress being put on that IT band. The main thing to look for. But what happens as a result of that? Well, that foot is going to land a little bit more in the center, as opposed to being right under the center of your body, as opposed to being, under your shoulders or whatnot. You're going to see a little bit of hip drop on the other side, again, coinciding with that weak glute med. You might see your head drop down a little bit more as well, but that's also going to be due to, again, that femoral adduction. So the big question, what do we do to fix this? Well, the big thing, you're going to look at those weak muscle groups. So glute med, your hip external rotators, which will also include your glute max, and also find some ways to retrain your gait. Now, how do we do that? There are a couple different ways. One, we can look at retraining our gait by a cue called running quietly, which basically means we're going to try and decrease the amount of force with each step. Sometimes this goes hand in hand with increasing our cadence, which is another big way to help retrain our running mechanics. What we do with that is set a timer with a metronome, and you want to time every foot to step with the beat of the metronome. And you want to have this a little bit higher beats than people normally would. Again, what is this going to do? What it's going to do is that when your cadence is higher, you're spending less time on your feet, which means there's less force going through each foot when you're running, which means less stress going through that area as well. When there's less stress, usually there's less pain. Another way we can retrain gait mechanics is what we call a forward lean. Now, what is that going to do? Well, when you lean a little bit more forwards when you're running, you're going to shift the focus of the muscle group from your knees to your hips. That creates a little bit more hip extension. So you're moving around the muscle groups to an area where, it's a lot more forceful, and those muscle groups are a lot stronger than the muscle groups around the knee. So again, when we are changing forces, we're taking away area that's might be stressed a little bit more, so the outside of that knee, bringing it to an area like the hip. What else do you need to know about this injury? I think the biggest takeaway from this is that it can take a while for the irritability in that knee to go down, especially if it's really, really bugging someone early on. Again, since this is not a contractile structure, you can't stretch it, you can't strengthen it, but you can strengthen around it. So a lot of education and consistency with these exercises for these key muscle groups is really, really important. Next time, we'll talk about the third most common running-related injury, which is shin splints. But for now, I hope you enjoyed this video. Good luck out there on the course. I'll see you next time.